am a human chiropractor and an animal chiropractor, as well as a naturopathic doctor. But in my human and animal training, I get questions on why and when should they be adjusted. So this is Miss Lily Potter. She is, and that's Aria. I also adjust this little monkey sometimes, but she doesn't need it as often. So Lily is a year and 5 months, and she plays really, really hard, especially when she's at her cousins, my best friends with her dogs. She'll jump on and off and on and off of big things, and so I noticed that her lower neck starts to get really tight and twitching. And earlier today, I saw her kind of bite at her back right here, and if you can see when I push on it, I don't know if you can see that from here, but it flinches. So basically, I obviously try not to over adjust her or anything like that, but if I see that she's been doing a lot, or she bites at her back, or is moving differently, then I will check her and adjust her. So disclaimer is you either have to be a veterinarian or a human chiropractor to even get trained in animal chiropractic. So this is not something that you just do or have your regular chiropractor do. I went to a specific school in Kansas for 6 months and got trained and internationally certified by the IVCA, which is the International Veterinary Chiropractic Association. There's also an AVCA, which is the American Veterinary Chiropractic Association. I'd love to get certified by them, but they only do a test once a year in, I don't remember where, Oklahoma. And I just have never been able to do it. So I'm going to walk you through me adjusting Miss Lily. It's a little bit different than when I am at a vet office, because I usually have my dogs on a bail. But we're gonna see if I can get her to cooperate through this whole thing. Okay, can you stand? Up, stand, come up, up, yes, good girl. So I'm just going to palpate her neck and adjust. That's a good girl. Adjust the areas that need to be adjusted, especially her lower neck. Do you feel good? That's a good mama. Oh, right there. Oh, you did twitchy right here. I know. Yeah, it's a good job. You did it. You did so good. Yeah, somebody really. Oh, I know that was a rough one, but you did so good. So, interesting fact, dogs, horses, cats, cows, a few other animals do not have clavicles. So right here, I can run my finger around the whole front of the shoulder and up and around. Their front legs are just connected to their neck and their rib cage with muscle, and about 70% of their weight's on the front end. So this is why I'm a huge proponent of harnesses, especially well-fitting harnesses, and collars should really only be used for identification. I will never lead her on just her collar because they don't have clavicles. So I'm checking her jaw, and there's a little tight spot right there in her jaw. Just a good girl. Yeah, if that makes sense. Not leave the kitty. So I just make sure, especially with little dogs looking up at the world all day. Oh, you're already stretching. Hold on, wait. Come here. We gotta do the pelvis, okay? So yeah, I already know right here. That's a good girl. That's a good job. Let me see. Okay, that's better. Yeah, and then your little sacrum. I get it. That's a good baby. It's a good baby. Sometimes she gets a little bit Aria. But if you can see, when I push on Lily's low back, her back twitches a bit. Not sure if you can see it from there, but she's got quite a few areas that are sticky. But we also, I know. That's a good girl. Yes, that's a good girl. We drove up to LA last weekend and then continued it further and went all the way to the Bay Area to treat horses in my hometown in Cupertino. And then she ran around barns and played with her cousin Bubba, with her Uncle Ross. And they have a very high bed that her and Bubba were jumping off of. It's way better. Way better. I'm going to hold on to a knot right here. They'll also get knots just like we do. But there we go. Is that better? The way that I always treat them is, and people, Aria, seriously. This is just stuff. Leave the kitty. Because of the way they're balanced and our bodies are balanced, I always do neck and pelvis first. And I think I explained this in my horse adjusting video. I know that I posted. But these are like the two grounding kind of areas of the body. And then as they, hold on, leave the kitty. I know, I have a moments left with Lily's attention here. They kind of twist, right? And so if you were to wring out a towel, where does all the tension go? And that's usually right in the middle. Most dogs, I also work at 2 vet offices, and one of them is a traditional vet office, and most of the dogs will have IBDD or degenerative disc disease or things like that, where they're getting degeneration in their mid-back or middle of those tension areas, and that's because rest makes resty and motion is lotion, and when you have all that stress, thank you, Lily. I know. I'll finish up, and then I'll explain more. I will. I know, we got a rib right here. I know. There it is, you did it. Hold on. No celebrating, but you did really good. You did really good. I know. So, I know, but you jump so much on your shoulder. Can I see it? So, usually I'll have the owner like hold the face. This is my dog, so I'm not worried about it. But if it's somebody else's dog, can you just bend? Thank you. I'm just checking it and make sure it moves. Thank you. I know. I appreciate it. Can you stand? Thank you. Good girl. Good stand. Wait. Let me see. That's your good girl. I know. Aria gonna help you. If you think dogs and cats can't get along, you are mistaken. You're crunchy in your knees here, Mama. So I'm stretching her quad and hip flexor because it was a little better. You're crunchy. Since when you get so crunchy in here, huh? Oh, you good job. That has a good stretch. This one's crunchy too. It's from all the jumpings, huh? Oh, there you go. Good job. Okay, you're all done. You did it. So, something that I didn't explain that I usually explain to the dog parents or even my human chiropractic patients, you're welcome, is that every single joint in our body or their body has something called a mechanoreceptor, and that's a motion receptor. So if one of the joints in her back is not moving, it tells the brain, and the brain says, okay, let's protect it. And so that tightens, right? And it's all about quality of motion in the joint. It's with animals, I can't really check I can check the neurology, but I can't check where their body thinks it is in space so much. It's more of a, is it tender? Is it moving well? Is there inflammation or swelling? Just kind of, again, like quality of motion and quality of health. So, here, crawl. That's a good girl. That's my good girl. So, that is small animal chiropractic. In the state of California, you have to work under veterinary supervision. These are my own animals, so it doesn't really matter. But for the most part, unless I'm at a barn, I do, not for the most part, unless I'm at a barn and I'm already seeing horses and it's part of that, and I know the dogs are under veterinary supervision and they're okayed by their vet to see me, I will see them, but otherwise, small animals must be seen under vet supervision per California law. So, if your regular chiro is seeing them in your vet office, that's also not okay. Or in their chiropractic office, that's not okay. Because I work at Animal Healing Center every other Friday right now, and I work at West Coast Animal Hospital alternating Saturdays, so that I'm always at one vet office a week. But I hope this was informative or helpful or kind of clarified some things for you guys. Somebody feels really good now and she gonna be sleepy. Usually after the first adjustment, they knock out, they get really sleepy and just kind of reset. But yeah, simple, gentle, super effective. Just make sure you have a good doc.